What's up, guys? John here. Titan Talk Tuesday. Another great Tuesday. Another great week here at Titan Medical Center. Man, we got a lot of things going on. We had another big weekend this last weekend. If you didn't know, we were at that Festival of Speed Sunday. We had the Titan Classic, and we had water. So we had three huge events Sunday that Titan Medical Center was a part of, was a big portion of. And I was at these events with Tsikouris, and we had a lot of the Titanettes out there representing. We had athletes on the stage at the PCA. They did awesome. The Titan Classic went awesome. So thank you, Ian Harrison, Kevin Taylor for that. All our people at Festivals of Speed, all the exotic car owners that came out to us. And a lot of people knew us already. So that was really, really cool. We had an awesome setup at all these different places. Tsikouris was doing interviews. It was really, really good. What up, Jim Ray? How you guys doing? How's everybody going out there in Instagram land and Facebook land? I hope you guys are all having a great start of your week too. So at that point, it's just one thing after another with Titan. I mean, we're trying to grow as much as possible, and it's happening. A lot of people are out there, and they're noticing. I appreciate you guys' support. And if anybody is against us, I appreciate you guys as our fans too. So at that point, we are going in a lot of different directions. Even this Sunday. So this Sunday, we have Europa. Anybody that knows or goes to Europa knows it's a huge fitness expo. They have supplements, gym clothes, but they have a lot of great events like jiu-jitsu, arm wrestling. They've got some bodybuilding competitions, ninja courses, and a lot of different things. So you can bring out the family and enjoy a lot of different things. It's not about bodybuilding or anything like that. And it's a great, great energy in there. Well, Titan Medical Center has been a part of that. I think going on, almost 4 years now. And at that point, we've always gotten bigger and bigger and bigger in that aspect. And we've always brought a better presentation because it's all about being better each day, progressing each day, finding that higher point that you can go to. Not being greedy, not saying that the grass is greener on the other side, but wanting to progress all the way through, right? Because life should be about that, about evolving into a better person, having a better quality of life, and living a better life. So, Europa is going to be huge. We got tons of guests coming in. So I've got Jerry Ward coming in. Craig Broski, who's a Titan athlete. I've got Big Drew coming down. He's a part of the Titan team now. Jeff Culp, that's my demigod right there of Titan Medical Center. My man Chris Gaines, he's been with me forever. Kristen Medina will be on there on stage. She's showing. Lee is coming in town. So IAB Pole, Lee Charlotte is coming. First time in America. Titan Medical Center is bringing her over from South Africa. All these people will be doing meet and greets. I can't forget my girl, Stacey Masita. She's going to be there. And all the rest of us. I'm going to be there. Man, Jay Cruz is going to be there. We're going to have tons of photography. Art's going to be there. We got all the girls' Titans coming. It's going to be a production and show. I promise you that. And we're right when you come in the door at booth 40 and 41 to the left. So if you're in the area, definitely come by. And when I tell you we've got awesome giveouts this year, we've got some really, really cool surprises coming your way. Free leggings, free tank tops. I've got some new shirts coming your way. A lot of different Titan gear. So look for the Titan gear. Look for all the Titans. Come over, say hi. If you're interested in a program, come over, talk to us about it, right? I know I have my doctor out there, right? Real medical doctor is going to be out there. Our nurse practitioner will be out there. Just out there answering questions because that's what we do. We want our medical staff to be fully involved with you so you're getting top-notch patient care and first-class therapies. So we'll all be out there. It's going to be awesome. So if you guys are coming out there, please let me know. It's going to be great. All right. So therapy is coming up. I'm going to talk to you about the therapy of the week. It's not really a therapy of the week, but I will go into it. So blood testing. This week for Europa, we want to do a huge special. So, you don't have to be a patient. You can be somebody that wants blood testing, or you can be a patient. It's $130 for a full male panel. We usually sell this for $200, $150 discounted. So $130 is your price. You can secure it if you're a new patient. If you're an old patient, you need blood 6 months from now, you can secure it now by paying for it. Females, instead of the $300, we don't discount it down to $225 for you guys, but it's going to be $200 now. So at that point, full male panel, $130. Full female panel, $200. The reason is because there's more tests on the female panel. So at that point, you guys should really take advantage of this. I wanted to do this for Europa because A, I am health driven. So everybody that's competing or any kind of athlete or any person should really know what's going on the inside of their body. The reason I press this so hard is because without our health, we're nothing. So I want to make sure that you are educated and you guys know what's going on in your body. Think of yourself, and I always go back to a car example because everybody drives usually, and everybody can see, if they drive a car and they have a tire that's off, the rim's off, there's a flat tire, that car is not going to drive optimally. It's going to be boom, 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 boom. So you're not going to get optimal use out of that car. Now, if everything's right on that car is going to perform optimally. It's going to run smoothly. Everything's going to be great in that car. So that's what you want. And really, that's about testing and tuning. And the way that you really know what's going on the inside of your car or body is through blood work. So that's why this special's come up again, because the blood work tells the true story. On the outside, I'm seeing guys aesthetically just phenomenal. On the inside, not so much. I know a lot of people out there that have ruined their bodies and are giving this advice to other people. That's not good. So make sure you guys are coming to a real medical professional that can go over these lab results with you, that's going to do the consultation with you, that you can see face to face or through video at least, right? Recorded. You're not talking to somebody on some phone. You know and can pick your medical practitioner or doctor out in a group or crowd, let's say at the Titan Medical booth at Europa Sunday or Saturday, right? So that's going to be awesome. So I don't want you guys to miss out on this special. $130 for guys, $200 for females, full male panels. Get it while it's hot. That's all I can say, right? Let's go into some of the events, and then I'll talk about some of the other stuff. Ernie signed up today. That's awesome. So Ernie he took advantage of it today. That's great. Everybody asks me about discounts all the time. I try to throw them out there as much as possible. Nobody can touch this apples to apples testing. So literally, compare the test that you're getting from anywhere else and compare this. Compare the price. You are going to see that we are definitely cheaper or less expensive than them. I don't like to use the word cheap because that's a bad word. But less expensive is a lot better and better financially for you. So that goes together. All right, let's talk about more events that are coming up. We've got a lot of events coming up still. So Europa all weekend, we'll be there, right? You'll see us there. You're coming out if you're in Florida, Orlando. If you're a competitor, regular person, come up and say hi, ask us questions. After that, we've got the Deepwater Classic, June 15th. It's on a Saturday. And we've got Mr. Olympia. Sean Roden himself will be in the house guest posing. So if you're on the NPC or the IBB and you're doing some show around here, or at least the NPC anyway, you definitely want to get in this competition. Don't go for anything less. Mr. O is the heavyweight bodybuilder. There's no other Mr. O's. He's the Mr. O, for sure, all right, of this year anyway. So come out, meet Sean Roden, take some pictures, see him guest pose, and wish him good luck hopefully for this next year. All right, guys? So after that, we've got PCA Miami, right? This is July 7th. This is going to be an awesome show down in Miami. If you guys are doing any other contests or anything like that, think you can hit the stage, definitely hit this up. It was a lot different show when I seen it this weekend. When they did the overall, they had bodybuilders in there, they had physique in there, they had a couple different competitors in there, and it was overall in the best in their class. So it wasn't just the best on stage aesthetically and how big the guy was or how it was, but it was literally the best person that was the best in their class that won overall. And it was definitely a shocker. For me and some of the people in the audience, it was really, really cool. PCA, definitely check it out. Titan Medical Center will be there in full effect representing, and it will be a good show. I guarantee it. So it will be awesome. All right, what's the difference between all stuff and gear? Okay, so let's get into some questions here. Daniel, that was the last question I see, so I'll answer that. What's the difference between Titan Medical Center, prescribed, doctor monitored, testosterone, hormone replacement therapy treatment, and gear? So the difference between that is you're getting your gear from your buddy. It's the underground lab. You have no idea what the testing is. You might not need it, right, medically. It might not do anything for you. You might not even know what it is. That's the difference. From us, you're going to get labs done. We're going to know what's going on. At that way, our medical provider or doctor can treat you properly. And at that point, we can give you the right medications to get you feeling optimal and healthy, not just throwing things in your body that you have no idea where they come from. This should be a serious health concern. And I do get it from a lot of guys. Listen, I've got friends in all different areas of life. And at that point, some guys, they like it. It's $20 from their best friend. It might be made in a bathtub. Other guys, They don't want anything unless it's coming from a U.S. licensed pharmacy. It comes from a doctor. They can verify their prescription. They know exactly what it is, and that's all they want to put in their body. So it's really up to the person. But I've seen a lot of infections. I've seen a lot of fake things going around. So I would caution you just to be on the safe side. What is your health worth? What are you willing to invest in it? You know, some people, they don't have the money, or they're not financially able to do it. I understand that. But if you are, I would not be risking or taking Russian roulette with your life, your body, or infection. I've seen other guys get an infection, have to cut out big chunks of their muscle. All right? It's not fun. I've seen it done, okay? You don't want to be in that situation. That's why I'm here to educate you guys, to at least help you out. Listen, you guys don't have to come to Titan Medical Center, but I want you guys to at least monitor your blood, to at least know where you're at so you can make a healthy and educated decision. Keep those copies of all your blood tests you've ever got from us, from other doctors, from any other place that you've got blood. That way you can always track your progress. You can always go back to that file, and if something happens to you, God help you. Nothing does, but if something happens health-wise, you can hand that file to a doctor and they can track your blood, and maybe it might help you in the future or for that situation, okay? So that's the difference between us and them. Sorry, guys, we cannot do Poland. Now, that's Art. Hey, what's up, Art? Say hi. All right. So at this point, what we are working on right now is we are working on other countries. 31 countries is what I was talking to a guy about today. So Titan Medical Center might be the 31 countries. He said he's already got the setup over there and everything like that. You know, I never will talk about it or say it's done until it's done. But he did hint at it today, so I think it's really, really cool. Can you guys still prescribe TRT levels that are in range but are on the base level? Okay, so here's the thing. With TRT or hormone replacement therapy levels, all right, the doctor is going to get, your new patient paperwork, see what's going on. Now, the range of testosterone, let's say on LabCorp, is from 210 to 946, right? At that point, it's a big range. And if you fall in that range, let's say at 300, a normal practitioner is not going to treat you. They're going to say you're within normal range. Now, that could be a 21-year-old or it could be a 60-year-old. And at that point, the 21-year-old is going to feel like the 60-year-old because that's the number that 60-year-old should be at. At that point, you really don't want to be like that. I'm not saying a 21-year-old should be on testosterone either. Don't get me wrong. But I'm just making an example from one spectrum to the other. And both of them, they should be at optimal levels. So at that point, if you're feeling down, you're lethargic, you're holding belly fat, you're doing these programs, working out, you're eating, but you just can't get the results or they're coming too slow, that's where maybe some of these hormones might be deficient or off, and you can correct them. At that point, when you correct them, you'll get to where you want to go faster. I promise you. Expedite results. You'll feel better all the way around. It's about quality of life and feeling your best. That will help you perform at your best, okay? So I hope that answered your question. Barnes, party of 4. If not, call or text us. Guys, we service nationwide in the blood testing, hormone replacement, bioidentical for males and females, medical weight loss, our custom vitamin and amino acid injectable therapies. They're niche therapies. These blends or formulations are only for our clinic. Yeah, there might be some vitamin blends out there, but they are not superior to ours. I guarantee that. So just compare what's in them ingredient-wise, each active ingredient. So at that point, we do that. We do rejuvenation detox, libido enhancers. Girls, we have hair health capsules for your hair, skin, nails. A lot of different things that we can help you out with. Healing peptides, immune boosting peptides like thymosin alpha-1, TA1. And I'm going to have that as a therapy of the week here in the next week or two. So look out for that one. That one is great. I've been taking it for about a month and a half. God help me. I got a big event, a lot of stress on me, but I haven't broken down yet, thank God. And stress will help break your immune system down, along with hard training, endurance, and a lot of stress on you. Good stress can turn to bad stress if it's too much, right? So make sure you guys are getting some stress relievers out. All right, so I think that answered that. I'll go up here and answer. What up, Amy? How you doing? Neil, what's up? Craig, I can't wait to see you. It's going to be on, man. It's going to be really, really on. I'm really, really happy with everything. Michael Whites, how you doing? See, he just received a call. Man, have a job again. Awesome, dude. That's awesome. See, we love, our patients are like family here, and we love to hear what's going on in their lives. It should be about leveling up, positive growth. I mean, with all our patients, that's a positive effect, man. That is contagious. We like to be positive. I'm not going to let any negative stuff bring into Titan because you guys are bringing the positive energy. When I hear things like this, it's awesome. What do we got here?
You couldn't see the comment, so it's right there, so you can answer it.
Oh, cool. Okay.
The bottom one.
Bottom one. Hey, William, we have about 3 different live videos.
I love that.
Looking forward to visiting the Tampa facility. Okay, getting live. Oh, you. So, guys, we love people coming to the facility. We've got a beautiful 4,200 square foot facility here. Every time I bring a franchisee down, man, they come in there, wow. And that's like, for me, that's really, really humbling because we didn't start like that. We started with $2,000. We started one way, and we've grown into this. So, for us, for me, it's like every day, I promise you. I feel like that, you know? So, it's really, really cool. I'm really, really glad everybody supports us in this way. I mean, I'm really, really happy. All right. Did you say $130 for a blood test this week? Just what? Yes. Jim Rat, I'm telling you. Yes. $130, full male panel, all those tests. What do those tests? Are those tests in that plant panel? A CMP, comprehensive metabolic panel. Comprehensive metabolic panel 14. That means there's 14 tests just in that panel. So the main ones you're going to cover in that, electrolytes, liver, kidneys. Next one, CBC, complete blood cell count. That's going to tell you white blood cell count, red blood cell count, hemoglobin, hematocrit. These different things are going to tell you if A, your blood's getting thick, right? White blood cell count usually tells you if there's infection in the body. So there's different things that these will tell you. If you're on hormone replacement therapy, like testosterone, males or females, you want to be checking your complete blood cell count at least every 3 to 6 months to make sure that these levels are not going up. The reason is if hemoglobin, hematocrit, and red blood cell count go up, your blood can thicken like sludge, cause DVTs, strokes, a lot of different bad things that can happen to you. So make sure that you guys are aware of this, especially if you travel up in airplanes for a long period of time. This is a big cause of these different things that can happen. So make sure you mind these things. Other things that are covered in there. PSA for guys, that's a prostate through blood, right? We want to do a cholesterol panel for you guys. Make sure it's all covered in there. Full thyroid panel, T3, T4, TSH, right? Thyroid stimulating hormone. We also want to do your vitamin B12, free and total testosterone, estradiol levels, progesterone levels, and IGF-1 levels, which are your growth hormone levels. So you're going to look at a lot of different things in here. Our medical provider or doctors will be able to look at this. Now, if you just want the results, that's fine too. You can just get the results. But if you need help, there's treatment, or you just want to monitor, we can help you out there too, all right? So definitely take advantage of that special. You're very welcome, Jim Rat. All right. Yeah, man. All right, so I got my big Punisher out there. He's working, and my man Pat Russo. He's doing some big things out there. I appreciate it. Definitely hit me up. How do you have other protocols to give you more of an advantage building muscle? Also, I have some shoulder pain. Do you have something to help me heal faster? Ligaments, joints. Okay, so we do have protocols that will help you build more muscle. Now, we're not going to give you a whole bunch of androgens and anabolics to do that. Now, if your testosterone is low, you need hormone replacement therapy. We obviously can help get those to optimal healthy levels, right? The next thing after that, you want to look at, I say this to everybody, nutrition, all right? Everybody says nutrition. Yeah, look at what you're eating. If you're not eating enough calories, you're not going to build the muscle. If you're not sleeping properly, you're not going to build the muscle. If you're not training properly, you're not going to build the muscle. So at that point, you got to have those 3 things first. After that, there are some different things like Hercules Potion and stuff like that that possibly can help you build more muscle in those areas. And you can spot inject if you want to in those areas for more instant gratification. At that point, you can help lagging areas, or you can make areas better, bigger, like if you want to, I guess. Just, you know, I guess everybody's different. So at that point, we will customize and help you do that with your regimen. There are also some peptides that are really good with that, the GHRHs. And then for shoulder pain and ligament pain, definitely BPC 157, TB500. BPC 157 has helped me tremendously. It helped me with shoulder pain about 1.5 years ago, 2 years ago, when we first had it roll out from the pharmacy. And at that point, what happened was I hurt my shoulder really, really bad. I couldn't push 25 pounds. And at that point, I documented the comeback as far as my shoulder went as me lifting the weights. Now, I don't know what happened in the last 2 weeks. I tweaked my shoulder again. I think I got an impingement. But I've been shooting the BPC again, and I'm feeling a lot better. I mean, a lot better from what I was. So hopefully I'll get to push some weights because I got to look good in Europa, right? You guys, I'm in person. I guarantee the pictures match the person. So I guarantee you come up to me, I'm going to be 6-pack loaded and be ready to go. All right? What you see is what you get. And make sure that whoever's leading you guys leads by example. That's what it's all about. All right. Asking about California. Yeah, we can definitely help in California too. Yeah, that's not a problem. California too. So I just had somebody come in that possibly might be part of Titan Medical Center in California. I'm really, really excited about that. So hopefully that does go down, and you guys have a center you guys can walk right into in California and Vegas, hopefully. So a lot of big things on the rise. I'm really, really excited about those things for sure. All right, yes, Michael White's full panel is definitely worth it. All right, does it help build bigger muscles? Yes, there are some different things that can help build bigger muscles, like we talked about. And everybody wants to do that. Everybody's like, is there a secret to building bigger muscles? There is a secret. Yes, you're going to have to train. You're going to have to do these different things. It just doesn't come like snap of your fingers. You're going to have to put in the work. So that's a big thing. I mean, I think a lot of people like that. I'm with Royal Medical. I just learned about you guys. Can I still work with you guys? Yeah. So if you guys are with another HRT center or general practitioner or whatever it is, and let's say you want to try some of these other therapies or you need some blood work or whatever it may be, we can help you out. We can definitely help you out. You don't have to get just testosterone from us. We don't want that. We want patients to be able to come to us so we can help them with their goals. It doesn't have to be testosterone hormone replacement therapy. We have a lot of different things we can offer you, and you can be taking these hormone replacement or testosterone from some other place. Now, some general practitioners or doctors are only giving patients testosterone, and they're not looking at estrogen levels like estradiol levels, or they're totally against aromatase inhibitors, which are estrogen blockers. Now, this could be detrimental to your health. It could be. It might not be, but it could be. So at that point, you always want to make sure that those levels are right, because with high estrogen levels, we know that can fuel cancer. We know that can make you irritable. We know that can cause bloating and water retention, and possibly high blood pressure with the water retention. So at that point, you want to make sure that you guys are safe and taking your therapies. You're taking the hormone replacement without any of the negative side effects, or very, very minimal, right? You want the positive effect without the negative. So at that point, you really want to dial yourself in and make sure you're good. Another question is HCG. So with HCG, we do HCG weight loss. We also use it with hormone replacement therapy as add-back therapy, making sure the testicles don't go into atrophy. We make sure that there's a mimic signal of the luteinizing hormone going down to the testicles, making sure that you're, producing, and that there's a full effect aesthetically. So at that point, it will help you on your hormone replacement therapy. It will help libido. It can help in other different ways. All right. Every one of our patients is on it as far as hormone replacement therapy, and it's a big, big benefit. So I hope that answers some of the questions there. All right. Definitely be in touch, man. No problem. So I think that's pretty much about it. I mean, I think I've covered a lot of different things for you guys. Now, I want to definitely do a giveaway too. Let's do the giveaway. So the giveaway is for a $100 gift certificate, or you can add it to any special or blood testing that we do. It's hashtag Titan Gift. And you're going to text that to 727-389-3220. That's going to give you the $100 gift certificate. Hashtag Titan Gift, right? If you want some free Titan gear, and we've got a ton of new Titan gear, of the leggings, we've got jumpsuits, we've got all kinds of stuff. Hashtag Titan Gear, 727-389-3220. I'll give some time while you guys do that and let those come ringing in, because there's always that. All right, so we don't do growth hormone here. Growth hormone is highly regulated by the DEA, and it's looked down and frowned upon, so we don't. But we have some other alternatives. We have some GHRHs, which are growth hormone releasing hormones, or GHRP, growth hormone releasing peptides. So at that point, you can take Emperelin, right? Emperelin. You can take CJC 1295, which is a GHRH. It's an injectable. And you get the Iperelin both together. At that point, you're going to get a better effect. It's going to help stimulate the posterior and anterior of the pituitary to help you produce your own growth hormone, right? There's also an oral version of the GHRH. That's MK677 or ibumortin. At that point, you can take that capsule and it will stimulate the GHRH in your body so you can produce your own growth hormone. And it usually raises IGF-1 levels pretty decently. I mean, we've seen it through blood tests in some patients and really get a good result. Now, with the MK677, there was some water retention in some of the patients and stuff like that. So if you're getting ready for like a show, you might not want to take this right beforehand, or a photo shoot, you might not want to take this beforehand. But if you're trying to gain some good muscle and you have nothing really you have to shoot, and you can diet down a little bit afterwards, I mean, I think it's worthwhile. IGF-1, we do IGF-1 LR3. We actually have a combination of IGF-1 LR3. It's got, I think, CJC 1295 and Iperelin in it too. So you're getting GHRHs and the IGF-1. That's a really crazy combination. And I know some of the patients have tried it and love it. So if you're looking for that step up, that might be it. Do we prescribe DECA with our TRT? So nandrolone, right? We do some nandrolone, but you have to have supporting documentation for that. That is not something that is given out. That is not something you're going to get right away. That's not something that we give out like candy, and you're not going to be like, oh, I have a shoulder pain. You're not just going to get nandrolone for that. So I just want to make that clear. But it will help, with some of these different things. If you have chronic pain or some of these different things that qualify you for it as a therapy. When doing MK677, does it ruin your natural growth hormone secretion? It's a good question. Does it? I don't know. GH can for sure. So if you're asking about growth hormone, that could definitely do it. Now the best thing you can do is you want to test your baseline level of your IGF-1. That's why we do blood tests, right? So we can see where the baseline's at, and you can see where you're at. Now, if you have a really good level, why even mess around? And if you're asking questions like that, you probably shouldn't mess around because you probably heard it just messing around like what you're going to do. So if you see it, you test it, and if it comes back good, don't break it or don't even take a chance. If it's low, then you're probably going to need some help in that area anyway, so I wouldn't worry about it at that point. It just all depends on you. Everybody's different. That's why it's a custom therapy regimen, because my therapies might not do you good and your therapies might not do him good, and so on and so on. Or one therapy can work for everybody. It just all depends. So at that point, you really just got to take that in consideration and make sure it's personalized for your effect. All right, guys. I think that's really about it. I appreciate you guys. Come out and see us at Europa. I can't wait to see my Titan fan, man. It's going to be a big Titan reunion. You guys that are attending, you guys wait. It's going to be on. So pay attention to social media. Lee's coming to town tomorrow. I'll probably go live with her. First time in the U.S. I can't wait. And if you don't know who she is, pay attention. All right? Keep it locked to my Instagram, Facebook, Titan Medical Center, right? Titan Medical on Instagram. YouTube, please go press the subscribe. Plus, all kinds of different videos on educational, on how to do the injections, what therapies we offer, how to travel your therapies. Plus, Sharice's soapboxes are in there too. And if you haven't paid attention to her soapboxes, definitely check that out. All right, guys. I'm John from Titan. I appreciate you guys all tuning in. I'll see some of you guys at Europa. And if not, I'll see you guys on social media, guys. I appreciate it. Thank you.